Thank you, Chairman. The 340B program, it requires nonprofit hospitals to have a contract with state or local government to provide charity care for low-income patients. We know that. But the GAO, the Government Accountability Office, found that more oversight is needed to ensure that these contracts are valid and in compliance with the statute. Dr. Ippolito and the whole panel, thank you all for being here today. Doctor, what are the potential benefits of implementing a stronger verification process for contracts to ensure that 340B savings are allocated to those that are most in need?
I think this sort of builds on some earlier comments, but the sort of lowest hanging fruit, it seems to be in this area, is that we have existing policies that are meant to subsidize hospitals and meant to explicitly subsidize the care of those who cannot pay in full or at all. And so 340B is certainly one of those, and so it strikes me as entirely reasonable to set up some standards and enforce some contracts about what exactly are you doing with that money.
Are those fairly straightforward verification procedures?
My understanding is that there is almost no verification of what you do with 340B money at this point, and so anything that moves in that direction seems like a step in the right direction.
But it wouldn't be overly complicated to create a system of verification?
It doesn't seem terribly complicated, no.
It seems like one of the central problems, not just with that, but with the American healthcare system, is just that it's not consumer-friendly. I faced that as a parent. But, you know, so you got some providers out there that are very creative, like the Surgery Center of Oklahoma. They've posted transparent prices. I saw this years ago traveling to India. I think it was Apollo system. If you want a knee replacement, there's the price. It was basically a menu. You know the infection rate, you know the statistics for the hospital. People traveled from all over the world there. That's been several years since I was there. But you see innovative menu-like pricing and consumer-friendly pricing and systems in Oklahoma. So they've also negotiated directly with employers, and they've reduced administrative overhead. And what we've seen is that it's led to more savings for patients and decreased opportunities for medical debt to accrue. So how can providers differentiate themselves in the market by offering more consumer-friendly arrangements and better upfront cost estimates for patients?
Yeah, I mean, I think this speaks to a broader point. Insurance works best when it is focused on these rarer, expensive conditions that are very hard for people to prepare for. It doesn't work so great if you're covering relatively routine or predictable or shoppable services. And so I think this question is sort of getting at this point of, well, can't we do this a little bit more efficiently if we skip all this administrative cost? And you allude to a point that comes up all the time when the CFPB writes on this, when people submit comments regarding medical debt, the complexity of billing and inaccuracy of billing is a major issue here. And so to the extent that these models move towards a simpler, more transparent billing model, that seems like a major step in the right direction.
I like the way you started with that. I think you pointed to the difference between the promise of health insurance and the promise of health care. Very different. What are some of the obstacles to more simple, consumer-friendly arrangements?
Well, right now, I mean, if you're an insurance plan, you have to cover all sorts of mandated things, and the federal government, through a variety of regulations, essentially dictates some essentially minimum coverage requirement. That's the federal and state governments have roles in that. And the more you do that, the more that you make it kind of challenging for anybody to deviate. It also, I will note, tends to preference the largest players. If you are a big player and you put handcuffs on anybody else from making a different product that somebody might be interested in, that tends to help you maintain your market share. So those are the things I would point to.
Any other ways that you can think of off the top of your head where government is the obstacle rather than the solution when it comes to healthcare providing?
You know, I think one of the big things that Dr. Bai brought up is the government often has well-intentioned policies that has unintended consequences that we are very, very slow to unwind. Things like Medicare policy that encourages consolidation and higher Medicare spending is a great example. 340B tends to push in that direction as well. So I think those are sort of first-order issues for me. Government policies that tend to push towards consolidation and higher costs that underpins all of the conversations we have about medical debt and related issues.
Thank you very much. Thank you all. Chairman, I yield back.
Thank you.